So hi guys, today we'll be talking about the classification of the ovarian tumors as well as the FIGO staging of ovarian cancers. So to begin with, whenever we talk about the ovarian tumors, this histological picture should come into each of our mind to classify. So anything that arises from the surface epithelial cells, that is the surface epithelial cell tumors. The tumor that arises from the germ cells, that is the germ cell tumors. The tumor that arises from the sex cord stroma and the stroma is the sex cord stromal tumors, and any metastasis from any part of the body like that is metastatic tumors, like Krukenberg's tumor, that's from the breast, it could metastasize to the ovaries, so that is metastatic. So we have surface epithelial cell tumor, germ cell tumors, and the sex cord stromal tumors and metastatic tumors. Further, if you want to classify, you can classify it as benign, borderline, and malignant. That's for surface epithelial. Rest everything has just benign and malignant forms. Okay. So under this surface epithelial cells, the benign form could be wherever you're using benign forms, you have to use adenoma, cyst adenoma. So you could have serous, mucinous, endometrioid. This could even have the benign variant as well as the malignant forms. Okay. So cyst adenoma. But when it goes to malignant, it's cyst adenocarcinoma. Borderline is just it has atypical features, but you can't classify it like clear cut as benign or malignant. Okay, that could also have either serous, mucinous, or endometrioid variants. Okay, so serous, mucinous, endometrioid is common for and Brenner's tumor. Brenner's tumor is also there. It has a benign as well as in case of malignant forms as well. Okay, so coming to germ cell tumors, we have again benign and malignant forms. Under that, we have benign is nothing but mature teratoma or dermoid cyst. Under malignant forms, we have immature teratoma, yolk sac tumor, dysgerminoma, choriocarcinoma, to name a few. Okay. Then under sex cord stromal, you again have benign and malignant forms. Benign, you have to remember fibroma and thecoma. And malignant, we can remember granulosa cell tumor, Sertoli Leydig cell tumor. Okay. So that they are the malignant forms. And the metastatic one, you can remember as Krukenberg's tumor. Okay. So ovarian tumor classification is done. This will be coming as a part of a 5 marker or a 10 marker classification. Okay. Coming to staging of the ovarian tumor. So this is basically any staging. It just starts with like the first stage will be always limited to that particular organ itself. So limited to the ovary. Stage 2 is limited to the pelvic organ. Stage 3 means it could go from pelvic organ to abdominal structures from the pelvic brain. Stage 4 is metastatic, and here it's not just metastatic. Like earlier in other cancers, we have learned like there's regional mets and local distant mets. But here stage 4 is only distant mets, directly distant mets. Keep that in mind, okay? That's an important aspect to remember. So stage 1, let's start. Stage 1, as we already discussed, it is limited to the ovaries, okay? So stage 1A, we have that is just involving one ovary, okay? Stage 1B means both ovaries. In each of this case, there's an intact capsule of the ovary, okay? And there's no ascites feature. Stage 1C consists of rupture of the capsule, okay? In this stage 1A, 1B, there's no capsule involvement. But in stage 1C, there's a rupture of capsule, which can further be classified as intraoperative 1C1, 1C2 could be perioperative, 1C3 is malignant ascites. When this rupture and could lead to malignant ascites. Okay. So I hope I have made myself clear through stage 1. Stage 2 is pelvic organs. So what pelvic organs? So stage 2A involves just the fallopian tubes and the uterus. Okay. Stage 2B involves either the bowel or the bladder. So the colon here, that's the bowel, and or it could be the bladder involvement. Okay. So bowel and bladder is stage 2B. Okay. So stage 2 is all about other pelvic organs. Okay. This is all within the pelvic cavity. So all other pelvic organs. Now coming to stage 3. Stage 3 means it could spread from pelvis to abdomen. Okay. Or pelvic brim. From pelvis to abdomen. Or from pelvic brim to the abdomen. Okay. So stage 3A1. So 3A1 we have. Okay. Under 3A1 there's retroperitoneal lymph node involvement, retroperitoneal group of lymph nodes. 3A2 consists of microscopic invasion from pelvic brim to the abdomen. Okay, that's just microscopic invasion. Then coming to stage 3B, there's no any further classification for 3B. It's just macroscopic spread with the size of implant being less than 2 cm diameter. And 3C is just the same macroscopic involvement, but here more than 2 centimeter diameter, the size of implant. Okay. And remember one more thing, in both 3B and 3C, what happens is the liver and spleen surface can be only involved. Okay, surface or an intact capsule. Okay, because this is very important, because in the coming stage I'll make you understand it better. Okay, so stage 4 is all about distant mets. There's nothing to do with regional mets. Regional mets is like bowel and bladder involvement, that already goes in stage 2B, right? So stage 4 is all about distant mets. Keep that in clear. Okay, it's distant mets. It's very, very important, distant mets. Okay, you have to keep that in mind. It's just distant mets. Distant. This has to be kept in mind. So under that we have 4A, that is malignant pleural effusion. Okay, or 4B, that involves liver or spleen parenchyma. So if parenchyma needs to be involved, the capsule will have to be ruptured. Here I told that it could only be the surface of the liver or with an intact capsule. Okay, parenchyma is not involved. Parenchyma, if it is involved, it directly goes to stage 4B, liver and spleen parenchyma with ruptured capsule. It is once again the same thing in a better tabular form I have just given you. You can take a snapshot here for better understanding. The same thing I have explained here. Yes, so it is stage 1 is limited to the ovary, because this is all about FIGO staging of ovarian cancer, right? So stage 1 is just the ovaries, limited to the ovaries. Stage 2 is involving other pelvic organs. See, 2A is fallopian tube and uterus, 2B is the bowel and bladder. Then coming to stage 3 is 3A. 3A1 is retroperitoneal group of lymph nodes. A2 is just microscopic involvement. 3B and 3C is both macroscopic involvement. So remember this is common for both. Then here this is common for both. Okay. So you can take a snapshot here. Yeah. And stage 4 is here only distant mets. Keep that in mind. Okay. Because in other cancers, this entire thing is pretty much, not the same. So in many other cancers, stage 4 is consists of metastasis, and 4A is regional mets in other cancers. Metastasis, okay. When I say mets, it's metastasis. In other gynecological cancers like endometrial or cervical cancer, 4A is regional mets. But here you see bowel and bladder is 2B. But here it is like 4A is regional mets, that is bowel and bladder involvement. Okay. So I just wanted to make that point also very clear. Okay. That's it. Thank you guys. I hope you have understood the concept better. Please do like, share and subscribe.